I will pass it on to Sam to kick off our patient and multidisciplinary team panel. Thank you so much.
Hi, thank you so much for that. So I'm going to bring us a bit full circle. So one of the things that really struck me earlier, and I want to make a point of mentioning it, was that actually something, it was Dr. Tawbi, you had said earlier at the beginning, cures are possible. And I got to tell you, from a professional and personal level, that is particularly powerful. So for those who are not aware, so AIM at Melanoma was founded in 2004 in memory of my sister Charlie, who passed away from melanoma. She was only 26 at the time. And the reason the foundation was started was because we knew that there was a huge need for resources in this space. And so I am really excited to hear when I hear, and it wasn't just at the beginning, when I hear the word cures being used. It was not something that was something we even talked about 2-3 years ago, to be honest, if that. And so I'm really glad to hear those words being used. But we understand that there is still a lot to be done. And so this foundation is here to support all of you, to support the providers, not just here in the US, but globally we are reaching out to patients and families and caregivers to support them. And so I just want to spend a few moments and go through what some of those resources are. So we have things that symptom and side effect management sheets and guides. There's a lot of treatments out there. The side effects are difficult to live with. They are important that they are recognized and managed so you can stay on treatment, and we have those. So I will go to the second slide. So as I indicated, we have a symptom and side effect management sheets. This symposium, like all the other symposiums and the events that we have, are recorded, and we do make those available in our video library. So that is another resource. We also understand the importance of hearing other people share their stories of hope and survivorship, not just patients, but families, and so we have that resource as well. We heard about clinical trials. We have a clinical trial matching service that we provide. We have a peer-to-peer support program. Whether you are a patient or a family member or a caregiver, we are matching newly diagnosed families and patients to those who we are veterans so that they could support each other. I mentioned Ann Taylor, our new Director of Community Engagement. She can help match you with somebody who help you maybe with stage, gender, age, a lot of variables, and we'll do our best to match you with somebody who can support you, or you can support someone else. We also have a comprehensive list of helpful organizations. Not one organization's, unfortunately we can't do everything, but there are great organizations that help with financial needs, housing, lodging, nutrition, the AYA community, and we share those with you. We have our Steps Against Melanoma walks. I'm going to talk a little bit more about that in a second, but these are ways that we raise money for melanoma research, as well as bringing families and friends together and patients together to support each other. We have volunteer opportunities for individuals to give back. Again, that's something, and we're gonna put in our Engage at AIM at Melanoma email address in the chat feature so that you can sign up for any of these. And then we also have our Ask a Medical Expert. We have a physician assistant who works in a melanoma clinic herself, and she's there to help answer your general questions. She has her own webinar series on different topics to discuss some of the issues out there. And then again, I just want to go back to our Steps Against Melanoma walk. We actually do have one in the Houston area. We have coming up in October. We have actually several coming up in the fall. We encourage you to come out. This is not just an opportunity to raise money for melanoma research. AIM supports a fresh frozen primary tissue bank that we own and will be making available to researchers. But it's a way for the community to come together and raise awareness and to support each other during this journey. So without any more, I'm going to pass it back to you, but I just want to say thank you, everyone, for joining us. I am MD Anderson, Liz, and Rebecca, Hussein, Mike, everyone, thank you so much for joining us. Again, we are recording this. There will be a survey that is going to be pushed out to you after this event. Please answer that survey. We have, again, more symposiums coming up, and we will incorporate your feedback. So thank you so much, and now I'm going to pass it back to you, Hussein.
Thank you so much, Sam. That was really useful, and I have to say again, AIM is a foundation that I've had the opportunity to work with for over a decade now, and just have seen how amazingly it continues to develop and evolve, and just kind of respond to patients' needs, and it's just a fantastic organization. So. We're really, happy to be part of it and helping kind of continue to evolve it.